Alright, hi guys. My name's Rachel, and I am part of the major and mild neurocognitive disorders group. I'm going to be talking about Alzheimer's. So, exactly what is Alzheimer's? Well, there's actually this umbrella of dementia disorders, and underneath it, there's Alzheimer's disorders as well, or Alzheimer's disease, as well as Lewy body's disease, Parkinson's, vascular dementia, and frontotemporal dementia. Today we'll just focus on Alzheimer's since that's the most common one and it's the one in the DSM. Alzheimer's is a progressive degenerative disease that attacks the brain and results in impaired memory, thinking, and behavior. Some diagnostic markers would be plaques and tangles that are part of some protein neurons. They damage and kill the neurons in the brain, and that prevents the brain from receiving proteins, and then the neurons can't communicate with each other as well. So thankfully, brain scans can show this decay, and that helps with the diagnosis process of Alzheimer's disease. Alzheimer's, focusing on the DSM-5 criteria, it's under, well, I guess they label it as Alzheimer's disorder due to major or mild neurocognitive disorder, which means all the criteria in order to diagnose Alzheimer's must meet the general major or mild neurocognitive disorder criteria. And then Alzheimer's, for the most part, it's going to be a major neurocognitive disorder because when it's diagnosed as a mild, that just means not enough evidence is known to diagnose Alzheimer's, which can get tricky because you don't want to give false hope, but you also don't want to make people worried. But then if it is a mild neurocognitive disorder, it's just going to progress into a major neurocognitive disorder. So Alan Francis actually discourages people from diagnosing anyone with Alzheimer's due to a mild neurocognitive disorder. Moving on, there needs to be at least two cognitive domains that are impaired with a progressive decline, and that's for just a major neurocognitive disorder. A mild, it would be only one cognitive domain. And then there also needs to either be a genetic mutation, because there is an Alzheimer's gene, so genetic mutation, or evidence of some memory decline or learning, and then other functional decline, including motor. So one of those needs to be seen and evident for someone to have Alzheimer's. The impairment must also not be due to any other medical problem, from a physical health problem or another neurocognitive problem. Can't be psychological, and there can't be another substance use induced problem or side effects from a medication they may be taking. And then Alzheimer's presents itself as memory loss and forgetfulness. And that means this affects memory recall, it will affect learning, it usually affects short-term memory, and then as it progressively gets worse, it will affect the long-term memory. But some more severe cases, Alzheimer's can affect motor ability and balance, as well as executive functioning. Um, there could also be behavioral disturbances present, and these need to be specified when coding Alzheimer's. Some of these behavioral disturbances will include depression, apathy, irritability, agitation, combativeness, wandering, dysphagia, which is difficulty swallowing, incontinence, myoclonus, which is muscle contractions, and seizures. Then some other factors according to the DSM-5, the prevalence for Alzheimer's, you've got 7% are only they're between 65 to 74 years. The biggest percentage is 53% between 75 and 84 years. And then there's 40% between 85 years and older. There is an early onset. Some people do find themselves diagnosed with Alzheimer's between the ages of 50 to 60 years, unfortunately. And then the survival rate is usually 10 years after the diagnosis. There are times that it could be 20 years after, but when you are surviving the full course of dementia, you have it for multiple decades. Alzheimer is usually what will kill you, and it has a high death rate, mainly by aspiration pneumonia, so food getting stuck in the lungs and causing an infection. Risk and prognostic factors. Age is the highest risk factor. It's just going to happen. Your brain's decaying. Then it's traumatic brain injuries, which we'll talk more about later. There's also some genetic susceptibility, but it's not super high. And then Down syndrome at midlife, if you survive with Down syndrome into your midlife, as well as some multiple vascular risk factors. Some differential diagnoses that you have to watch out for. Normal cognitive aging, everyone is going to have some kind of memory loss and some brain decline, brain function decline as you get older. It's just what happens. The other dementia disorders like Lewy bodies or Parkinson's, they can still have similar symptoms and match up, but you have to be careful that it's not one of the others. Delirium, which we'll talk about later, an intellectual disability, substance intoxication and substance withdrawal. There's malingering, major depressive disorder, bipolar, and schizophrenia. And then some comorbidities. Comorbidities. Because of the older age of individuals with Alzheimer's, there can be multiple medical conditions that develop as whether it's from falling or just a weaker brain and immune system. They can develop, and then this can complicate or worsen the disease. Many times people will get sick, and because of their Alzheimer's, they can't handle being sick from even just a small case of the flu. And then depression and bipolar disorder can also develop from an Alzheimer's diagnosis. And then finishing up with vulnerability, these risks are significant impairment and memory will affect your social life, your work life, if you're still working, and just your daily life, these daily routines that you have, you're not going to go through them as easily. And so this is going to lead to possible accidental self-harm when you're in the kitchen or the bathroom. So you're sexually vulnerable and financially vulnerable. Driving, because you can get lost or forget how to drive. And then falling by losing your balance or tripping. And then the treatment, sadly, there's not currently a permanent treatment or cure for Alzheimer's disease, but science is advancing and the research is continuing to develop and get closer and finding new ways of testing in order to prevent and cure Alzheimer's. So we're still holding out hope, but that's what Alzheimer's briefly is. And next we will have delirium. So thank you for listening.